Thank you for joining us, Dr. Kepler.
Thanks for having us on. We're glad to be sharing some time with you today.
In my experience, what I see in society today is that people turn to drugs in relief of symptoms before thinking of chiropractic first. Is that because it's quick and people just want a quick way to relief?
I absolutely agree with it, and you said it right there. It's quick. Pain is a motivating factor for people.
It is.
Often we can maybe address somebody's health and say we need to do something to address it, but if they don't have pain involved at the time, sometimes they're not motivated to do it, a certain percentage of the population. But why I feel that people rely on pharmaceuticals in particular is because they are quick. You know, you can pop a pill and within 30 or 40 minutes be getting some effects from it. If you have to change your diets or go through corrective chiropractic care, there is a time involved with that. Even though I feel like they're 100 times better, sometimes people will opt for the quick fix.
Now, you've talked about corrective care or maintenance care in regards to chiropractic. When it comes to pharmaceuticals, are pills considered corrective care?
No, I don't really feel there's corrective pills. You know, if you think about certain pharmaceuticals, there are some pharmaceuticals that they tell people you have to take for your lifetime. Sometimes we hear about a baby aspirin. But if you read the statistics, taking an aspirin every day increases the chance of risk of stroke, which is supposed to be the exact opposite. Corrective chiropractic care is really about not just removing the symptom or making the person feel better, even though we want to do that because we care about how they feel, and they obviously care a lot about how they feel, but we also want to get their spine and nervous system functioning as good as we can. That way the problem doesn't return down the road.
Now, you've talked about corrective chiropractic care. Do you consider this the same as preventative care?
Well, preventative care is similar to corrective care, but it's almost a different entity. Preventative care is really about when you're at a certain stage of health that you like or want to maintain. To me, preventative care is periodically getting yourself adjusted, more like some people term it maintenance or wellness type care. That way, you keep yourself in good shape. You don't wait for those bad things to happen or show up.
Yeah. I'm sure there are people sitting there watching and thinking, this all sounds good, and yes, I am under chiropractic care, but at the same time, I'm taking so many medications. Is there hope to get them off of them?
Absolutely. You know, not completely anti-medication, because in emergency situations they can be necessary, but for lifestyle and for wellness, I don't think there's really a great place for them. And we do have a lot of patients that come in that are on medication. Sometimes you'd be shocked at how many medications they take every day. And people absolutely can get to the point in their life where they don't have to take them, but they need to make changes. And so it boils back to that person. You know, is their health a priority? Are they willing to make the changes to get out of that mode or that entity?
Now, when you say changes, are you talking chiropractic? What do you mean by changes?
Well, changes are the 5 pillars of health. You know, the chiropractic adjustment, in my opinion, is the most important, because what it does, it allows our innate intelligence, our nervous system to function again. And really, everything in our body, down to every cell, every organ, every tissue, operates via our nervous system. And if it doesn't function properly, then there's no way we can be healthy. So chiropractic adjustments are absolutely the first step, in my opinion. But there's also other things that attribute to it. You have to eat well, you have to exercise, you have to get good rest, and you have to think well. Really, to be a well person, you have to do all 5 of them. Think of this: how many professional or collegiate athletes every year fall over dead? You know, there's 1 or 2 in the country that we hear about, and we know that physically they're seemingly in very good shape. But there's other components. Or somebody that eats, they supposedly ate a very, very good diet, but yet they developed cancer. There's lots of components to being well, and those are what we have to take care of to get ourselves or our lifestyle changed.
Makes sense. I'm curious, in your opinion, if someone said they wanted to start living a healthier lifestyle, they get adjusted, they eat well, but they don't really exercise much, should they concentrate on their strengths or on their weaknesses?
Well, I've always said that, if you can master one of the pillars, get one of them completely under control, then it's very easy to transition to the next one. Because if you're eating perfectly almost, or very well at least, and you're in a very good routine doing that, then it's pretty easy to add exercise in, because what happens when you start eating better, your energy level goes up. You feel better, the inflammation processes in your body go down, and so you feel more like exercising. Then you start exercising, the same happens again. And it almost becomes, I'm going to use the word addictive, and I hate to use that word, but people like the way they feel, and they want to keep it up.
Yeah, getting back to corrective or relief care, it is often not drugs that people turn to, but surgery.
You bet.
Do you see surgery more as a relief care or corrective care, and where does it fit in?
Well, chiropractic is really opposite of surgery if you think about it.
Yeah.
Surgery is typically an invasive procedure. Some surgeries nowadays aren't real invasive, but surgery, is usually removing something or repairing something through stitching it up, or moving a ligament to that area to rebuild something. In my opinion, it's still relief care. The sole purpose typically is to remove discomfort. Now, with that being said, there can be certain types of traumas, where maybe, part of our body is just damaged beyond the capability of it repairing itself. And then that obviously, is a good situation for surgery. But, a lot of surgeries are done, again, because people throughout years haven't taken care of themselves, and maybe their joints have got so degenerative, or instead of doing the lifestyle changes they need to repair themselves and heal themselves, surgery is just a quicker and easier option for them. Or even better, some people will opt for surgery because their insurance will pay for it, but their insurance won't pay for lifestyle changes, which to me is confusing.
Yeah, I'll say. And if you break your arm, you don't want to run to your chiropractor.
Absolutely not. Again, that's emergency care.
Yeah. So after surgery, what role does chiropractic play?
Even if you broke your arm, that's going to be a stress to your body, stress to your nervous system. So in theory, a fractured arm could cause subluxations in the spine, which would start to deplete your health. So anytime you have any kind of physical trauma or physical stress, it could be poor posture, it could be the type of work you do, it could be a car accident, it could be fracture in your arm, or you could have chemical stress, poor diet for a long period of time, or maybe you work in a place that has a lot of chemical exposure, or you live in a city that is very industrialized and has a lot of pollutants in the air. All that is a stress to our body and our nervous system, which can affect our health. And the other type of stress is emotional stress. If you have a job you don't like, if you have maybe problems with your significant others or financial trouble, all that affects the chemistry of our brain, which affects how our nervous system functions, which in turn can create those subluxations or that nerve interference that we've been talking about.
Sure. We're running out of time, but I'm wondering, how about our children? Does all this that we've talked about hold
Absolutely.
true for them?
I'm a huge proponent of having your children checked for subluxations the minute they're born. I have 4 kids. I checked them as soon as they were born for subluxations.
That's great.
My kids have never had an aspirin. They've never had a Tylenol. Until last year, I used to be able to really kind of brag a lot. They've never had a doctor's visit. But my youngest, he got to go to the emergency room last year because he wrecked his bicycle and impaled his abdomen with one of the pegs on it. But the point I'm making here is my kids have been very healthy. And part of that I attribute to chiropractic, most of it. And we also make them eat well and do some other good things. But getting your kids checked is the most important thing I think we can do for their health. They're so easy to work with when they're younger. They heal much faster than an adult does. And why not start your kid off on the right foot? We often don't have kids checked for subluxations or nerve interference because of why? Because they don't have pain. Well, pain doesn't tell us much. A lot of times we can have no pain but still have nerve interference. Think of the guy that fell over dead yesterday with a heart attack. If we could back him up a day in his life and said, how do you feel? What's he going to tell us most of the time? I felt fine. But really, was he healthy? And the answer is no. And so getting your kids checked is imperative.
Dr. Kepler, I want to thank you for joining us today and sharing this information.
We appreciate you having us.